Good morning. This is our third lecture in bone and joint pathology. In this lecture, we will classify bone tumors, describe the pathological features and radiology of benign tumors and the malignant ones. Here is a simplified table for all the primary tumors that can affect the bone, whether benign or malignant. This is another scheme for the bone tumors, whether benign or malignant. Here are the features of the first benign bone-forming tumor called osteoma. The most important clinical picture is the disfigurement if it appears in the outer aspect of the flat bone. But if it appears in the inner aspect, it causes a pressure effect, whether on the brain or on the eyeball, causing proptosis, in the sinuses causing sinusitis, in the auditory meatus causing conductive hearing loss. Radiology, it is shown as a dense compact bone. Under the microscope, it's a mixture of lamellar and woven bones. Here is a patient with an osteoma in her forehead. Appears in the X-ray as white lamellar mass. Sometimes it's present in the orbital cavity causing proptosis, and under the microscope it's formed of bone lamella. The second benign bone-forming tumor is the osteodystioma. It occurs in a young age group in the long bones at the area of metaphysis. It's a painful tumor due to production of prostaglandin, thus it's responsive to aspirin. It forms a radiolucent nidus smaller than 2 cm surrounded by a reactive sclerotic rim, and under the microscope osteoid tuberculi are seen lined by osteoblasts. Here are the radiology of osteodystioma with small osteolytic lesion surrounded by sclerotic bone, and under the microscope bone lamellae lined by osteoblasts. The third bone-forming tumor, benign type, is osteoblastoma. It occurs in young age group. The vertebrae are mostly to be affected, but may be long bones at the area of metaphysis. It's a painful tumor as well, but it's not responsive to aspirin. It forms a radiolucent lesion more than 2 cm with no surrounding sclerotic rim. Under the microscope, osteoid tuberculi are seen lined by osteoblasts. Here is radiography for osteoblastoma showing an osteolytic lesion larger than 2 cm, and under the microscope osteoid tuberculi lined by osteoblasts. Here is a table to differentiate in between osteoid osteoma and osteoblastoma regarding the size, the site, pain, and bone reaction. Let's shift to the malignant bone-forming tumor, which is the osteosarcoma. It occurs in the young age group, but may be older age in cases of secondary osteosarcoma, like a predisposition from Paget disease, for example. It affects the lower femur and upper tibia in the region of metaphysis. It may cause pathological fracture and radiology, it may be on osteoplastic or osteolytic. Osteoplastic, there are two important features: Codman triangle and sunway appearance. We'll explain it later. Osteolysis is shown as a radiolucent lesion. This is the gross appearance. This is the gross appearance of osteosarcoma, with a mass formation in the long bones, displacing even the surrounding soft tissue. Here are the radiographic features. We can see here clearly the Codman triangle. It is done by elevation of the periosteum by the soft tissue mass, forming an angle between the periosteum and the base line of the bone called Codman triangle. Another radiograph showing the sunway appearance by the reactive bone formation. So with radiography it appears as sunways. Both of them are osteoplastic with a new bone formation, while the osteolytic, it shows osteolysis and rarefaction of the bone. Here are the histologic subtypes of osteosarcoma. In general, the grade is divided into 3 grades from 1 to 3 according to the level of anaplasia. This is the classic osteosarcoma with osteoid formation and malignant osteoblasts. This is a fibroblastic osteosarcoma. As we see, there must be an osteoid matrix to identify the nature of osteosarcoma, but fibroblastic differentiation is present, thus we classify it as a fibroblastic osteosarcoma. This is another type of osteosarcoma called chondroblastic osteosarcoma. There is an osteoid matrix formation with an appreciable amount of chondroid matrix. Here is an aggressive type of osteosarcoma called telangiectatic osteosarcoma. It is a high-grade type with severe atypia, pleomorphism of the malignant osteoblasts. Another type called small cell osteosarcoma. There is an osteoid matrix formation but predominance of small cells occupying most of the tumor. The lowest grade of osteosarcoma is called parosteal, with a very little atypia in the osteoblast and osteoid bone formation as well. Thank you for your attention.